Hello, my name is Dr. Reshma Mahtani. I am Chief of Breast Medical Oncology at Miami Cancer Institute, Baptist Health, South Florida. An important question that arises in clinic quite often is regarding the role of the continuation of a CDK4/6 inhibitor beyond progression. For patients who have long periods of disease control on a CDK4/6 inhibitor and experience minimal progression, there is a temptation to continue either the same CDK4/6 inhibitor or switch to another one with continued endocrine therapy. Although observational data support the possible benefit of this approach, the MAINTAIN trial was the first prospective randomized phase 2 study to address this issue. Findings from this study were presented at ASCO, and here 120 patients with hormone receptor positive, HER2 negative advanced breast cancer who had progressed on endocrine therapy plus any CDK4/6 inhibitor were randomized to receive fulvestrant or exemestane with or without ribociclib. Most patients had previously been treated with palbociclib. Data collected during a median follow-up of 18 months showed that the median PFS, the trial's primary endpoint, for patients in the ribociclib group was 5.29 months compared to 2.76 months for patients in the placebo group. Although this trial did lend some support to this approach of continuation of a CDK4/6 inhibitor beyond progression, there are remaining unanswered questions. In this study, both endocrine therapy and the CDK4/6 inhibitor were switched. Therefore, whether the benefit noted was from the continuation of the CDK inhibitor versus a switch in endocrine therapy remains unclear. And of course, this was a relatively small randomized phase 2 study and should be viewed in the context of another phase 2 study, the PACE trial, which was recently reported at San Antonio in 2022 and showed no benefit to the continuation of palbociclib beyond progression. Again, as we try to reconcile the various reasons why these two smaller phase 2 trials showed different results, whether that's related to study design, the specific CDK4/6 inhibitor that was utilized, the patients that were enrolled on the trials, it'll be important to await the results of larger randomized phase 3 trials such as post-MONARCH before this strategy of continuation of a CDK4/6 inhibitor beyond progression is routinely utilized in clinic. Hopefully, larger randomized trials will definitively answer this question. And the good news is there are several novel therapies, including oral SERDs, AKT inhibitors, and newer PIK3CA inhibitors, to name a few, that will hopefully increase options for patients who progress on a CDK4/6 inhibitor.